So tonsillitis can either be viral or it can be bacterial. So a common cold can cause inflammation at the back of the throat. If it's a bacterial tonsillitis, it's due to an organism called Streptococcus. So a lot of people say I've got a strep throat. So in that, not only do you get inflammation of the tonsils where they become enlarged, quite angry looking, they can be red, they can have an ulcer or exudate or pus on them, and patients are usually quite unwell. So patients will then have like a constitutional upset, so more than a cold, they'll feel very run down. They'll have what we term as a hot potato voice and not be able to maybe vocalise as well, not be able to open their mouth as much, not be able to eat and drink, and they might have a high temperature as well. So the treatment for tonsillitis is basically a lot of supportive measures. So essentially patients have to take time off work, they have to rest, they have to make sure they're well hydrated. A lot of patients will have a high temperature, so they require paracetamol and some pain relief. And the treatment is actually giving them a penicillin-based antibiotic. And those patients who can't tolerate that, we give them alternatives. So there is a population risk of having just tonsillitis, and on average people are allowed to have 2 to 3 episodes per year. And traditionally, we took everybody's tonsils out in the 60s, but there's now a criteria to take people's tonsils out. And actually it's a recurrent infection requiring antibiotics about 7 times in a year or 5 in the preceding year. Now, these are just guidelines, and in some patients they might just get 4 very, very bad episodes, or they might develop an abscess called a quinsy, and that might be enough to warrant having their tonsils out. So although there is a strict criteria on number of episodes, I think it's always good to have a discussion with a specialist because it's affecting your quality of life, your ability to work, loss of earnings, etc. And if you accept the risks of having the operation, most surgeons will actually discuss that with you and go ahead if indicated.